to Biobi Health. So Jeff, tell me a little bit about yourself.
Okay, so I'm Dr. Obayashi. I'm a family doctor, been so for over 15 years now. And first half of my career, I was up in northern BC. I was an emergency medicine doc, delivered hundreds of babies, ran a remote stress testing facility. And then several years ago, came back down to the lower mainland where I was born and raised and have been doing family medicine and hospital medicine.
Okay.
Yeah. And so over time, seeing many, many patients, I realized patterns with chronic diseases that you kind of wind back the clock and think, well, how could we have prevented it from getting to this point where someone's coming into the hospital with cancer or a heart attack or a stroke or something? And I realized that at the top of every guideline, there's these recommendations to optimize lifestyle. And so as I've done more and more lifestyle medicine and functional medicine courses over the last couple of years, I've realized this is the key, and that's where I've been devoting a lot of my energy. And so even myself, from a young age, almost broke my back, and then my own heart one time did need electricity to restart. And there's certain family history problems in my genetics has even propelled me even more to look at this preventive medicine component to medicine.
Okay, let's wind back a little bit. Tell me a little bit about your childhood. I'm very curious now at this point where you almost broke your back, your heart needed to be shocked. Let's have a little bit of history behind those, what happened.
Okay, so as a kid, I'm fourth generation Japanese Canadian, was born and raised in Richmond, BC in the Houston area. And so as a kid, I guess I always gravitated towards being naturally good at math and science. I like that kind of stuff. And then activity-wise, my main activity was judo. So I did try bowling and baseball and basketball and all that stuff, but my main sport that I was good at, decent at, was judo.
Okay.
And so I did podium a couple times at the national level in Canada for that. But at the age of 17, unfortunately had an injury where I was bent backwards, just like a freak accident. My head touched my knees on the backward side. And then I slept off to the side, and I was kind of lying there wondering if my back was broken.
Oh, wow. So lots must have been running through your mind back then. And then, at that moment, so, at 17, at that age, that's when you start thinking of, I need to start applying for university. So while you were...
Well, at that time, I wasn't really thinking too far in the future. I was only 17. That I was used to training 6 days a week, so I was more just super focused on athletics, and I was actually a bit bummed or very bummed at the time because I was supposed to not do any exercise or run or do anything. And so basically at that point, I was in grade 11, shifted my energy from judo into academics.
Okay.
And so I think really without that back injury, I would never be a doctor now.
Okay. So then after all that, now that you're now excelling more into academics versus, athletics, then you went to do your undergrad. Where did you do your undergrad? What did you study then?
So then, fortunately at that time, grade 12 was the main marks you needed. And so I got into UBC, did my undergrad in cell biology and genetics. I got that degree from UBC, and then worked in a bacterial evolution lab for 5 months.
Okay, cool. So after working, most people that I know that works in a lab want to do research. So how did you go from working in a lab for 5 months to, hey, now I've been a doctor for 15 years?
Yeah, and so that's kind of the dichotomy or the decision someone has to make when they're doing an undergrad science degree is are you going to be a researcher or are you going to be a clinician? Like pharmacist and physio and all that stuff. And so at that time, that's what I was kind of testing out. So I was working on bacterial communication, which at the time wasn't really talked about very much. But now with gut microbiome stuff that we brought into Biobi Health, it's becoming more and more popularized, discussing microbiomes. And so this bacterial communication thing that I was researching back in 2002 is suddenly popular.
Okay.
Yeah.
So then after 5 months, you just said, hey, now I'm going to apply for medical school. Is that what happened?
So after 5 months, basically, I realized I didn't want to do a PhD in science and decided to go backpacking. My buddies had all just went to Europe, so no one was there to go with me, so I just went on my own.
Okay.
So I was backpacking in Thailand, and 2 months turned into 2 years.
Oh, 2 years. That's a long time. So what happened in that 2 years in Thailand?
I mean, basically, I kind of went everywhere, up north, down south. The beaches are in the south, parties are in the south, and then up north is more Buddhism, relaxing, and kind of a calmer way of life, which I think really influenced who I am and had a lot of positive impacts on my life because I was kind of always go, go, go up until that point. That's my kind of natural propensity to just fit as much into a day as possible anyways. So I think that was a good pause point to reflect on who I was as a person and determine path going forward, what's the optimal path.
Okay. So what did you do in Thailand for 2 years? 2 years is a long time.
I mean, most of that time I did vacation for a couple months, but then I quickly realized up north is where I felt most at home. And so kind of with backpack on, I went to an elementary school and asked if they needed a teacher, and they sent me to the neighborhood high school, and they said they didn't have enough funding, so they drove me to a different high school, and it was just perfect timing because at that time, around 2002, the government of Thailand was creating incentive programs for these high schools to create English immersion programs, and so they basically designed that around me.
Oh, wow. So you pretty much went backpacking for a few months, then suddenly became an English teacher for 2 years in Thailand.
Yeah, I mean, even that interview was very interesting because there's all these Thai people. It was their summer break, beginning of their summer break, and the principal, vice principal, a bunch of science teachers and math teachers basically said, we would like to do this program, and they got me into a room in front of a whiteboard and said, teach us about the cell. And so luckily I had just finished a degree in cell biology and genetics. And so I drew a big circle and I started explaining all the different organelles and how genetics and stuff works. And literally on the spot, they said, we're developing a program around him. And the program still runs today.
Well, it's amazing. So then after 2 years, what made you want to come home then?
I mean, I was very content there. But I had always wanted to apply to medical school. I had done, lots of volunteer work and wrote the MCAT, and it was always kind of a possibility. So while I was in Thailand teaching, I sent in my applications, had my 3 references write their letters, luckily got an interview and passed that, and then the rest is history, got into medicine and went to become a doctor.
Wow. So 2 years in Thailand teaching English, you had everything lined up to be a doctor, but you put that on hold and you still continued coming home to try. That's amazing. Mm-hmm. So then, after coming home after 2 years, that must have been a culture shock.
Yeah, big culture shock.
Okay.
Yeah, big culture shock. Because there I was teaching maybe 14 hours a week. The other 14 hours was developing curriculum, trying to translate all these Thai textbooks into English. Luckily, math is basically a separate language, so that was easier. But the science was a little more difficult. And then going from that kind of slower, calm lifestyle right back into medical school, which is again like 100%. Yeah, that was quite a difficult transition, especially the first year.
Okay, so then you pretty much did that, came back to Canada, did your medical interview, got into the medicine program. Mm-hmm. Then what made you, once you graduated, you did say that you worked up north, I think, mm-hmm. for a few years. Like, what made you choose to go, up north at the middle of nowhere to work?
I don't know. I think that was a little bit of Thailand, maybe. I haven't really thought too much about it, but I really like the idea of like your old school country doctor where you're doing everything and the community again kind of revolves around you. You're very involved. So that's what I wanted. Even after first year medical school, I realized that. And I put a lot of value in generalist like we do. The specialists are very important. But myself, I tend to be more of a generalist. So understanding many different things, maybe not as deep as a specialist, but can put the whole picture together. I think that's my natural strength.
Okay.
Yeah.
That sounds pretty cool. So then now that, you've had all this experience, I do want to wind back again once more. You did say you needed your heart to be shocked. Like, when and where did that happen? You sound like you had a very adventurous life up till now. So, what happened?
Yeah, so that was basically when I was up north. It actually happened while I was down here, back in Richmond, where I was born. But I was drinking a little bit more and having 3 cups of coffee a day at that time and not having the best lifestyle components like I'm getting into now with this lifestyle medicine stuff. And so I did have atrial fibrillation, which is a type of heart arrhythmia, and needed to go to the hospital, get it shocked back into rhythm.
So did you know you have this sister, or like how old were you when this happened?
On my mom's side, everyone has it.
Okay, but you didn't know you had it at the time.
I mean, I was drinking a coffee and just suddenly felt, my heart went from its usual 60 beats to like double that, 150 beats a minute.
So you felt that?
Felt it like instantly.
And then you just thought, hey, I'm going to go to the hospital?
I drove myself, which I don't recommend. But yeah, I went to the hospital, got it shocked back, and fortunately it hasn't happened since then, but due to my genetic predisposition, it's just another reason why I feel so strongly about optimizing cardiovascular risk prevention.
Okay. Wow. That's scary, but, interesting. So is that what brought you to thinking, hey, I need to start thinking, is it what brought you to thinking of Biobi Health? Like, I want to do something like that's more personalized and, health teaching and all that.
Yeah, I think this company is kind of a accumulation of many different things, but like, yes, my natural predisposition and realizing over time to get further and further back into prevention, but also just having friends and associates that were also interested in it and looking more into prevention themselves, doing functional medicine, lifestyle medicine, different training courses towards that. And then we were actually hiking in Patagonia and getting towards one of the top mountain ranges there in the O-Trek hike. And I awoke one night and, I mean, it sounds kind of crazy, but yeah, I basically had an epiphany of Biobi Health that the next 3 years, and that's what happened, building this company to what it is to try and prevent disease.
Okay, wow, it's amazing. So this company came, because of all your personal history. You just want a healthier lifestyle at this point because, now that you have a family, you just want everything, you want to prevent. So like, I know that you once told me something about this tree model that you follow. Can you just...
Yeah. I mean, I think the way to maybe explain to everyone on how to visualize how I see health now compared to before is, the first, dozen years in medicine, I was kind of up in the branches, where we have different branches of medicine, like cardiology for the heart, dermatology for the skin, orthopedics for the bones. And so we have all these different specialties and doctors managing different parts of the visible tree. But what I realized over time is that the trunk and the roots are all connected together. And what I used to kind of glaze over with occupation and maybe a little bit of social risk factors, I realized is very important in clinical outcomes. So the 5 main roots in functional medicine are social connection, sleep, stress, nutrition, and exercise. And so these roots are, I think, over time, I realized more and more important in patient outcomes.
That's pretty cool. Like, after you explain it, the way I see it is like, a tree or, let's say a plant needs fertilizer. Good fertilizer is, you never know what people use, but, at the underground level, good fertilizer, things grow healthier, bigger, better. So, in the tree model that Jeff was explaining, it's pretty interesting because, I see it as like when things people don't see, if you work on it, better outcomes that you never thought of. So that's pretty cool.
And one root, like someone it might be sleep, someone else it might be nutrition. One root can cause potentially many different branch problems. Okay. So it may seem like you have diabetes, high blood pressure, and thyroid disorder, or whatever combination metabolic syndrome some particular person has, but it's really multifactorial. So yes, there's different components coming from all different areas, including what I believe now is in the roots.
Okay, that's pretty cool. So you kind of have this tree model that you think of, and then you personalize this tree model. Like an example is like, one plant needs more water than the other. So based on looking at each person as a whole, you choose what works best for that person, or let's say the tree.
Yeah, and I think this kind of comes back to my genetics degree. And I actually recently went and interviewed my old PI, principal investigator, Dr. Redfield. She's a tenured genetics professor at UBC. And so we had actually a 3-hour-long conversation, and there's 2 YouTube videos that we're making about that as well, one on genetics and one on AI. So, I mean, she's kind of semi-retired, but super smart still. And I think I had to talk to her for a bit just to see her ideas of how to apply genetics to humans now and what's coming over the next 10 years. And I think medicine is going to become increasingly personalized over time. Like, we know from large randomized control trials what handful of drugs work for high blood pressure, but we don't necessarily do genetic tests and functional tests to determine which of those 5 are good for you.
Okay.
And so I think that's the future.
Okay. Well, thank you for your time, Jeff. That's a very interesting story.
Okay.
Yeah. Well, thank you for joining us in Biobi Health. We'll see you next time.